Hi, I'm Heidi Bassfield, Executive Director of Speak Our Minds and Speak Our Minds podcast. Suicide remains the leading cause of death for our nation's youth. It's nothing short of a continued public health crisis. And on this series, we wanted to team up with providers and talk about what children's hospitals and their teams throughout this country are doing to take on this challenge and work every single day to have things be different, better for our youth. As part of this series, you'll hear from those providers, their teams, and what they're up to. They'll talk about new practices that they're putting into place, what they think has changed about the conversation with youth mental health, what their biggest obstacles are, what they would do about those obstacles, and what they're really excited to be a part of over the next 5 years. We also feature stories from parent caregivers who really bring home why this work is so incredibly important and how we can all join and be part of these efforts as a collective to turn the tide and prevent youth suicide. Thank you for joining us for Preventing Youth Suicide, a series focused on bringing about change. All right, I'm here with Dr. Jamie Becker, who is with us from Children's Health, fabulous institution in Dallas, Texas.
That's right.
All right, tell me what you do there and what your title is.
I am the director of psychiatry, and I have purview over the emergency room crisis teams. I have a psychiatric resource nurse team. I have the play therapy services, and then consult liaison psychiatry and psychology.
Real slacker. Okay, so here's your question. How is the conversation around youth mental health changing, and what progress have you seen compared to just a few years ago?
It's a great question. I think, at least for us, the conversation, I think, is moving away from the COVID isolation crisis, and we're really talking about access to mental health services again. So I think during COVID, we were really talking about like that crunch of everybody just slamming the emergency room doors and not being able to get kids out of our ED and into services. And now I think we're shifting out of that. I mean, we still have that. We still have problems with boarding, but I think that crisis point of boarding, at least for us in Texas, is kind of moving past that point. And now we're getting back into those discussions of what spaces do we need? Where are we looking for our services at the next level of care? Where are our access points at? And where are we back to seeing kids struggling? Our rates of suicide are going up. Our rates of anxiety are going up significantly. And so we're not seeing the mental health crisis paths, but I think we're seeing our entry points into the system change.
When I think about like how these conversations sounded just a few years ago, I mean, we have come a fair distance.
We have.
What did it look like a few years ago in your mind? Like versus how we're talking about, thinking about, and planning around youth mental health care just a few years ago? What was it like?
I mean, I can only speak from my experience and what we were doing.
Yeah.
We were putting out fires every day.
Yeah.
Every day was just kids coming into the emergency room, and it was trial by fire, and it was all entry point through the emergency room.
Yeah.
And the emergency room was the primary point of entry for kids coming into the mental health care system.
Mm-hmm.
And we're seeing, I just think, less of that. And I think we're seeing way more kids come in through their primary care and through, just alternate pathways. We're doing more screening. We're asking that question more. And I think one of our big challenges is we're screening, but I don't think we know what we're doing with screening. I think lots of people are asking lots of questions, but they're getting back on moderate screening and they're going, oh, now what? Because I don't know that I have a mental health provider in my office to take this screening to.
Yeah.
Maybe I'm a primary care physician, or I'm a GI doc, or I'm an independent renal doc, and I'm doing a mental health screening because someone told me I should look at mental health because the rates are really high in my population, but I don't know what to do with that screening.
Right.
So I think it's just a different entry point into our systems.
Yeah.
And that, I think, we're hearing more of that.
Sure. Do you feel like there was a specific inflection point that really started to advance and change and shape the work and the conversations around youth mental health differently? I mean, do we chalk this all up to COVID?
I think COVID was a turning point. I think COVID put a magnifying glass on a problem that was already there. right?
Yep.
It's like the ant in the magnifying glass with the sun, and it just exploded everything.
Yeah.
And I think what it did was it put everything on hyperdrive. And then you add in the explosion of things like social media and the reliance on electronics during that phase.
Yeah.
And I don't know that our adolescents and our youth recovered from that level of isolation that they found themselves in during COVID.
Yeah.
So we went to a really strong reliance on technology and a disconnection from each other during that time. And that's the piece that I feel like folks didn't recover from as strongly, is that interpersonal connection and how to do that.
Yeah.
And I think prior to COVID, if you would have asked youth, what's the number one thing that you do to help manage your mood?
Yeah.
Not necessarily your mental health condition, but what's the number one thing you do to manage your mood? They probably would have said, I hung out with my friends.
Yeah.
I went out with my friends. I went and did something with my friends. And I think COVID changed that piece of the conversation. And it became, well, I got online.
Yeah.
I chatted with someone, and now the AI chatbots, right? And so that shift was really interesting and strange. And so we're in a whole new world with that too. So I do think that situation has changed. And I mean, that sort of that ticking up with that track with anxiety, that keeping up with the other kids and what I'm seeing online, that whole piece of things has really changed the conversation.
Last question. Looking ahead, what do you most want to be part of creating over the next 5 years?
I think for me, some of the stuff that I am most interested in are quality metrics. I am really invested in the idea of sharing ideas and sharing resources and coming up with quality metrics that make sense for all of us to be engaged in and really understanding what it means to provide good mental health to kids and families. I've talked to quite a few people throughout our days here that I grew up in a CFLN, so in the Cystic Fibrosis Learning Network. And some of the things that I learned throughout that network are this idea of you can tackle a problem. Everybody doesn't have to do the same thing to tackle a problem, right?
Yeah.
So it's this idea of taking, the guys came here, talked about it, the reef, right?
Yeah.
But it's taking this idea of we're going to teach you the skills and everybody is going to get the same workbook, the same quality improvement toolkits.
Yeah.
And then everybody's going to go back to their home location.
Yeah.
And you're going to solve this problem this way, and you're going to solve it that way, and you're going to solve it a third way, and you might come at it as a fourth way. But then the key is coming back together and sharing those ideas around this one thing, just one thing that we're going to move forward.
Yeah.
Right?
Yeah.
And sharing those ideas and saying, okay, we're going to commit to looking at improving access at the outpatient care.
Sure.
Right?
Yeah.
But we really need to take some time to focus where we're headed and do that.
Yeah.
So that's one piece of it for me. But really, this idea of quality metrics for me is that I've said it once and I'll keep saying it, is we are beholden to a lot of quality metrics in behavioral health. We have Joint Commission. We have U.S. News and World Report, which is a competitive process. Then we have, CMS. We have all these folks that want us to report out data.
Right.
We all keep those metrics. The interesting thing is those metrics are not the same.
Right.
So everybody wants different things, but there are no benchmarks. There's no national standard. Right? So we have things for HACs, for hospital-acquired conditions.
That's right.
And there are national benchmarks for what you are aiming for.
Yeah.
We don't have that in behavioral health.
Right.
So one of the questions I asked someone else this week was, well, what should our expected rate of behavioral health emergency be?
Yeah.
Should it be 0? That's not realistic if you have a hospital that has behavioral health kids on a medical floor.
Right.
But what should it be? And I don't know that we've asked that question, and I don't know that we've set a national standard. We are each benchmarking within our own data, and we're not taking that forward and saying, what are we all doing? Right? I think is a real opportunity for us to set some national standards, but it would take a lot of vulnerability and a lot of non-competitive sharing.
All right. Well, you heard it here. The future is in the development of shared approaches to quality metrics and outcomes. And we want to thank you, Jamie, for joining us today. And we'll look forward to coming back and seeing the progress you're making.
Sounds like a plan.
Thanks.